So I'm just going to do a quick video on how to medially tape your kneecap. So this is for anyone suffering with anterior knee pain, or sometimes called patellofemoral pain. The idea behind the tape is it's trying to improve the tracking of your kneecap and stop it moving too far laterally. Even though it might only be shifting it just a few millimeters, that's sometimes just enough to offload the sensitive or painful area at the back of your kneecap and make things less sore. So before we tape our knee, we need to make sure that we've got the knee slightly bent over a pillow or something like that, and we want to make sure that the thigh muscles at the top of the knee are nice and relaxed, and we can tell that's the case by we should be able to move and slide your kneecap forwards and backwards a little bit as well. So we're going to use some kinesio tape. We're going to use rock tape. So I've already cut a couple of sections, so about 5-6 inches long, and I've just rounded off the edges of the tape as well. That's just to stop the sharp end of the tape kind of getting caught on clothing and lifting and peeling back, and then it comes off your leg. If you are going to tape your knee, make sure you don't use any moisturiser or anything like that on your leg, because it will stop the tape from sticking. Luckily I've not moisturised my legs today, so we should be okay. And what we're going to do is, first thing we need to do is locate where your kneecap is. So we need to try and feel for the top and the bottom of your kneecap, and also to see where the sides are as well. We're going to take our bit of rock tape, we're going to tear it about 1 inch from the end and then just peel that backing paper off, so we've got it like that, and then we're going to stick that right in line with our kneecap on the outside of our knee and give it a good rub down so the adhesive sticks. You can do this taping technique as well with more of a rigid, what we call a zinc oxide tape. I tend to find I get similar results, to be honest, whether I use the kinesio tape or the more rigid tape, and I tend to find patients just tolerate this stuff better and it stays on for longer, whereas the zinc oxide tape, you tend to find it just kind of pings off as soon as someone gets up and starts moving around. So we're then going to peel the backing tape off off the tape and just fold it back on itself. So this means we can grab the tape like that without having to touch the sticky side, because that reduces its effectiveness. So what we're then going to do is find the outside edge of your kneecap. So for me it's just there, and then we're going to keep the leg nice and relaxed and push that kneecap as far to the inside as it will physically go. We take the tension on the tape, so really taking that stretch out as much as we can in the tape, and then we attach it down. Just that, and smooth down, give it a good rub again to activate the adhesive in the glue. And then we're just going to do the same thing with another strip of tape and reinforce that over the top. So same thing again, we're going to rip that tape, the backing paper about 1 inch from the end, and then just peel it off. Again, we're then going to just overlap the tape by about 1/3 to 1/2. So I'm just going to go and place it just above the other strip that we've already done. Give it a good attach and then make sure that's stuck down. And then again, what we're going to do is find the edge of your kneecap again. So for me that's there. Again, we're going to give it a really good shove over, making sure you keep the thigh muscles nice and relaxed. Pull the tape as tight as it will go and stick it down. Give it a good rub. So that should then give you a knee that kind of looks a bit like so. Step back far enough, you'll be able to see it. So it's just taping that patella from outside to inside with some tension from the tape.